So welcome to the MMA webinar featuring Sean Egan, the Director of COVID-19 Workplace Safety. The entitled event is Gaining Insight into the COVID-19 Special Enforcement Efforts. Let me introduce to you also our Director of Human Resource Policy, Dave Worthams, who will help MC the event in terms of following up questions and managing that portion of the event. Let me start out very quickly with some housekeeping to say this is a Microsoft Teams live meeting, which means you will see the three of us and the ones that are speaking. You will not be able to be on screen, but you will be able to provide questions through the chat function in Microsoft Teams. And we want to make sure you're asking those questions, and we'll make sure we apply them to Sean, and we won't let him off the call until he answers them the way we want him to answer them, to be clear. But Sean, thank you very much for being here today. You've been very transparent, very interactive with us. I don't know, I think this may be the third or fourth webinar you've done with us, and thank you for that. But there's a lot on the agenda. The MIOSHA emergency rules came out. DHS came out with guidelines. DHS came out with follow-up orders, and then you've recently announced a new state emphasis program. So give us your perspective on what all this means and how you'll be enforcing on and what you'll be enforcing with the MIOSHA orders, the DHS orders, so what does the enforcement strategy look like? So with that, Sean, thanks again for doing all this. And I give you the floor.
Well, thank you, Mike and Dave. So I really appreciate the opportunity to be with the manufacturers today. I know this is, one of a few times that we've been together. I can tell you all that you have great advocates in Mike and Dave. They are constantly engaged with us, very open and interested in the work that we're doing and trying to make sure that it makes sense and that you can understand it as well. So I appreciate the relationships that we've developed, and I know that we're all in this battle against COVID together, and we're trying to navigate our way through the best that we can. Certainly, dealing with the pandemic was never something we thought we'd be doing in 2020, and it turned into the whole year and longer. And while there is a flicker of light at the end of the tunnel with these vaccine announcements that we're starting to hear, I think it's important for us all to just keep our heads down, focused on what we need to do and push forward, because for the general population, as you've seen the news, we still have a long time to go that we're going to be dealing and battling with COVID. And as our case numbers continue to just spike up in Michigan and across the country and across the world, this makes those mitigation strategies we've been discussing and promoting all that much more critical. And it really increases the likelihood that COVID is going to be in your workplace. So we really have to think about what we're going to do if it hasn't already. I would imagine for many that might be watching or might watch this later that you're already having to deal with COVID in your workplace. And one of the things I do like to mention that Mike and I were discussing was, we're going to talk about some outbreak numbers and some other things. It's not that the workplace has COVID in it. It's that we're coming into it with COVID, and the way this thing spreads and some other factors create a lot of challenges for us moving forward. So I'm going to share my screen quickly and run through a presentation. I try not to be overly wordy, but I'm getting pretty good at it. Just one of those things that you develop over time as you're working through this. Now, I know I mentioned to you before that in the Department of Labor, with MIOSHA, with the governor, the goal truly has been to move Michigan to a position where we can get open and stay open. And the executive orders that you were navigating during the summer, now emergency rules with MIOSHA, there was a lot of consistency and very intentional consistency between what you were understanding and implementing prior to what you need to be implementing and understanding moving forward. There were some changes, but by and large, it's pretty much a static transition from one mechanism to the next. And what we've done recently, you probably saw the news today, we've launched a state emphasis program within MIOSHA, and I will explain what that is and what we're trying to do there. First things first, all of the news on COVID, even discussing vaccines and other strategies out there. A few things have been absolutely the same from the beginning. That's that need for social distance, face coverings when we can't do that, and good hygiene. Now, we know as COVID has developed that picking it up from surfaces is much less probable, and the large spread is coming from respiratory droplets and aerosols, which makes these masks absolutely critical to help ensure that we can contain the virus, as well as that social distance. So if we looked at the chance of transmission when we had the stay home, stay safe order, the chance was practically none because we were ultimately distanced. For many of you, though, you were critical infrastructure industries and continuing to work throughout that. So you've been implementing a lot of these strategies all the way through. One of the big challenges with COVID is that about 40% or so of the spread is coming from those that are asymptomatic. They have it, but they're never going to get symptoms. So they're going to get through your daily health screenings. They're not going to know that they might be spreading this virus. And just another reason that in your workplaces, you really need to be requiring those face coverings and maintaining that social distance to the extent that you can, for sure. So we've been talking a lot about workplace outbreaks. DHHS posts this data every Monday before 3 p.m. right on the Michigan coronavirus website. I look at the data and I take out things like schools, colleges, childcare, nursing homes, and detention centers because there are a lot of non-employees in those places that are going to get the virus. And while there certainly are employees, what I like to do is, for discussion at least, is focus in on those industries where we are better aware that these are employees getting the virus and that this is happening. And the outbreaks themselves, in discussion with Mike, kind of come into this consensus that the outbreaks themselves mean that you're doing what you're supposed to be doing. You're finding it in the workplace and you're reporting it to local public health. When we get the outbreak data, it is local public health being notified by you, reporting that to DHHS, and then put together on that outbreak notification spreadsheet that they update every Monday at 3. So an outbreak in a workplace does not mean an error. I don't get specific numbers. So an outbreak, according to the way we're categorizing these, are 2 or more people. So it could just be 2 people. It could be, more than that. I think Mike made a point to me that, the word outbreak makes it sound like a lot, which it might not be. And that could be true. In some workplaces, it could be a lot. So, but that's the way that data kind of comes together. Also, as that data is reported, local public health departments report into industries, and construction and manufacturing are lumped together. We do not get separated data to tell us if it's more construction or manufacturing. Anecdotally, we believe it's more construction than manufacturing, but any kind of high density work area is going to create some challenges there. The point of this slide here is just for us to recognize that as reported on the 12th, the week prior, they reported about 17 from social gatherings outbreaks and 93 in those workplaces, not counting colleges, schools, nursing homes, etc. So you can see that we're catching a lot of outbreaks at workplaces. We're having some spread in workplaces. So we just have to really stand together to make sure that we're doing everything that we can. And the positivity rate in Michigan is at about 14% as of today, which is a huge number and means that there is sort of uncontrolled community transmission. And like I said at the outset, means that it's more likely that COVID is going to show up in your workplaces, and you need to be thinking about how you're going to manage that. So as I mentioned, we transition to emergency rules. When we do emergency rules in Michigan, we develop those and we expect those to be in place for the next 6 months. They can possibly be longer, but there's a process for that. So we really looked at things that we thought for COVID needed to be static over the next 6 months. And then some of those, what we would call more variable tools as COVID changes, you're finding in the DHHS orders. However, you should know that MIOSHA's authority, most of you in the manufacturing space are very familiar with MIOSHA, is in the workplace. DHHS's authority is more regarding individuals, but they do have some authority over the workplace. If you do navigate the two, though, you'll see that DHHS really singled out workplaces to be handled by MIOSHA and applies standards to individuals and others as it relates to masks and some of the capacity limits. In the manufacturing space, we did not see a change on Sunday with the DHHS order on any operations, and they are really deferring to MIOSHA to work on that. So since the start of the outbreak, MIOSHA has received somewhere around 9,000 plus complaints. Now the norm is about 200 a month for MIOSHA. Just in the last 2 weeks, we're looking at about over 1,500 complaints. Certainly a big burden on the system, and they're working hard over there to make sure that they address those. Out of all those complaints received, not counting the last 2 weeks, the latest report I have doesn't include those yet, about 21% are coming out of manufacturing. That's over 1,800 complaints that we've received since March, just in the manufacturing space. And that statistically is the highest industry where we're getting complaints. Retail comes in at about 18%, healthcare at 15%, and then restaurants and bars at about 12%. So just continuing to see a lot of complaints come in the manufacturing space, so be aware of that. That can mean a few things. It could mean that there are problems there. It also means that that's a big segment of our economy, and there are a lot of workers there. And your employees typically are more aware of MIOSHA safety rules and procedures and those things. It could also mean that we need to communicate better between each other to make sure that everybody understands what the policies are, the protocols are, and how we implement those, so that they have a better awareness of what's happening in those workplaces. Because of the outbreaks we've been seeing in various industries, I know that you saw early in the week, MIOSHA launched an emphasis program that's going to focus in on office environments. We put the news and information on that one separately, intentionally, because offices, unlike you, are not that familiar with MIOSHA. There's not a lot of office place hazards that really rise to the level of complaints in normal times, and certainly COVID, like everything else, has changed that. And office environments have to become more familiar, and they're more controllable, in our opinion, on making sure that you have remote work as much as feasible, to wearing those face coverings and other things. Offices create some other challenges as well. But because of the outbreaks that we've seen in manufacturing, construction, and the complaint volumes that we've continued to see, we did launch a state emphasis program around manufacturing. This doesn't create any new rules, so the rules that you are becoming quite familiar with are the same, but this is a proactive tool. So I know that many of you are probably familiar with MIOSHA's planned programmed inspections, where they just stop in and will talk with employers and do an inspection. That's what an emphasis program is. We're going to randomly select some manufacturers over the next few weeks, and just a MIOSHA person will stop in. There's nothing underhanded. They won't just wander around. They will do what they always do. They'll contact management. They won't give you a heads up that they're coming, but once they get there, they'll contact management and conduct an inspection of that work site and look for compliance specifically as it relates to COVID-19 workplace safety rules. And a few of the must-haves that you absolutely have to have, and I would imagine the vast majority of manufacturers do, because as I mentioned, many stayed open. You have to have that preparedness and response plan. If you are watching and you don't, there is a template that MIOSHA created on our COVID workplace safety website for low and medium risk workplaces, which would include manufacturing. You need to have that COVID coordinator designated. That does not need to be a manager. That's going to be your person that's ensuring that COVID protocols are being adhered to. And employees are wearing masks, they're doing the daily health screenings, you have the markings on the floor, and people are following them appropriately to get into the workplace. You absolutely have to be doing those daily health screenings, because even though about 40% of folks spreading this are asymptomatic, meaning they're going to get through that screening, the other 60% we want to catch, because the absolute best thing you can do as it relates to any hazard in the workplace is to get it out of the workplace. You're going to need to do that training, and I know that manufacturers train routinely and regularly, so I know that that's happening, but make sure you're recording it and make sure it includes how COVID spreads and your plans and procedures and things like that. We do have some record keeping requirements in the rule. Those daily health screening records need to be maintained. The training records need to be maintained for a year from the time of generation. And what MIOSHA is looking for on the daily health screenings is not necessarily the answers to the questions. It's that, you conducted it, that for sake of discussion, Sean took the screening and he passed. or Sean took the screening and he failed. There's a few reasons for that, and one is that if a complaint's received, MIOSHA has an obligation to respond. Everybody knows that. Or in the worst case, if there's a fatality that's linked to the workplace, they have an obligation to investigate. And those are a couple of things they're going to ask you for. Were you conducting the daily health screenings, and what were the results of those screenings? And those complaints can come in after the fact. And certainly you're going to want the records to be able to point back to and say, here's what we have. So in the rules, there's a lot about face coverings. For manufacturers and construction largely, we do have some industry specific rules that have greater face covering requirements, but for these two industries in particular, but manufacturing, is what you're used to. The employer has to provide those cloth face coverings or non-medical grade surgical masks or something like that, that you have to require employees to wear those face coverings when they're not maintaining 6 feet of separation. And if they're within 3 feet, considering face shields. Now, when MIOSHA uses a word like consider, what they mean there is not that you just went, I don't really think so. It's that the face coverings are only about 70% effective in keeping that virus and cutting down that transmission. So 70% is not 100. So when we're within 3 feet of each other, if we're right next to each other on a line, if there were the maintenance folks and it's two workers working really close together, those face shields will add another layer of protection to protect the virus that might escape the mask from being able to transfer out too. So really think about that if that's something that you need. When we say consider though, obviously they can't create a greater hazard. You know, the face shields are not always comfortable. They fog up a lot. If that's going to create a greater hazard for that worker, it might not make sense. But if it's not going to do things like that, really try to implement that as a mitigation strategy, especially when we're seeing what we're seeing with the case numbers and everything else, that asymptomatic spread. We have to take even more steps, the best that we can. And then face coverings in shared spaces. So picture a production facility. You know, I work at a certain machine, I'm more than 6 feet away. More than likely I can have my face covering off while I'm doing my work, but as soon as I'm going to take off and go down to the restroom, those employees need to put that face covering on. That hallway is going to be a shared space. Think of those places where people could run into each other, where they might be having break or lunch or things like that. And I know that you're all doing the separate the tables and marking things off, but they're going to need to wear those face coverings when they get into those shared spaces, regardless if they can maintain that 6 feet of separation. A couple additional manufacturing specific rules in the emergency rules. Again, this was in the executive order, but you're creating dedicated entry points. One of the challenges certainly for manufacturing is you typically have a lot of people trying to come into a small space to get into a big space. So trying to figure out how you're going to manage folks getting in there, how they're going to do the daily health screenings, not get too close together, not end up hanging around each other for quite some time. One of the things that we did do in the emergency rules is to move the temperature component to a, if possible, standard rather than a required standard in manufacturing. I know that Mike had talked with me about, I don't know, 25 million times over the course of the summer about that specific issue. I think it is a valuable tool to try to catch those cases. When we are in a position now where we don't have that additional unemployment benefit to support people when they need to be off of work, we all know that people are going to come to work whether they have symptoms or not. So temperature screening might be a valuable tool, especially when case numbers are high, that you'll want to consider, but there is not a specific requirement to do that. And then just creating the protocols to minimize personal contact as deliveries are coming in and out, people are moving around, and how you're going to manage that. Well, a couple of things I really wanted to focus on, and I'll check my time here because I can yak forever, we're getting a lot of questions and a lot of confusion over quarantine and isolation for those that have been either a close contact or they are starting to show symptoms or something like that. So I'm just going to highlight those for you quickly. This is a critical tool, as no doubt you know that if COVID's around the workplace, the best thing we can do is get it out of there and try to isolate or quarantine those that might have had a close contact showing symptoms or a positive test. That certainly causes challenges for the workplace. We understand that. We know it creates hardship for those workers because they need to earn a living. But this is what we have to do because one sick person in there, not only would they have hardship if we get them out, but they could create hardship for everybody else that they might infect, and that's going to hurt your operation that much more. So what the rules say specifically is that if somebody has COVID or they're suspected of having COVID, and suspected means a close contact or they have symptoms, that you need to physically isolate them as quickly as you can. And that includes keeping them out of work through the daily health screening protocols, sending them away from work, or in some cases, assigning known or suspected cases to work alone. What that was intended for is we got a lot of questions on the letter C there on people that are more office focused, that can do their work remotely. Can they still work remotely? And the answer is yes, as long as they feel that they're physically capable, whether they have symptoms or not, whether they're confirmed or not, they can continue to work. You can make that, you can work that out with them. This is not intended to say, Sean, as the electrician, you can still come in and we're going to stick you at the other end of the plant. If they're confirmed or showing symptoms, they need to be isolated. And then the CDC guidance is what MIOSHA is looking to. And as you know, that changes from time to time. But the way it works right now is that if somebody is exposed, a close contact, they're not confirmed, meaning they've not taken a test, and they do not have symptoms, they need to quarantine for 14 days from the date of the last close contact. And I use that sentence for a reason, because this scenario has come up a few times, especially with our case number so high. If somebody in your household has COVID, they're confirmed to have COVID, and you're taking care of them, it's going to be 14 days from your last close contact with that person in your household. However, the CDC guidance does have, if you are able to isolate from that person in your household, it's 14 days from the last time you were close to that person in your household. Now, that's going to take a lot of discussion between you and an employee, but by and large, thinking of this in a workplace setting, if I come into work, I start to show symptoms and I do have COVID, whoever I had close contact with is going to need to quarantine for that 14-day period. And if they develop symptoms in that time frame, that's going to extend out the amount of time that they're going to need to be away from the workplace. A negative test does not get you out of quarantine. And keep that in mind, a negative test does not get you out of quarantine. So if I'm exposed today and I'm not showing symptoms and sometime next week I go and take a test and I'm negative, that does not end that 14-day period, because the virus can take hold and turn into the actual illness anytime in that 14-day incubation period. Now, isolation, using a separate term, sort of a similar meaning though, is that if they have symptoms or they are confirmed, it's 10 days since the symptoms first appeared, and at least 24 hours with no fever, without medication, and the other symptoms are improving. Now, if you are confirmed but you never get symptoms, it is still 10 days. So if I get tested and it says positive, it's going to be 10 days from there, whether or not I get symptoms. So those kind of function the same, but just thinking through that quarantine concept, I just really want to stress that point, because we're getting that question a lot on various type of workplaces on what they need to do if they have a positive and close contacts and things like that. And I wanted to touch on remote work, because this question has come up a lot, and I know in the manufacturing industry, we didn't say at the outset for you all watching, I'm a journeyman electrician in addition to all the work that I'm doing here. So I spent time in the field, in factories, on construction sites, doing this kind of work. So what I was going to say is, I know firsthand that a lot of production has production in the back, office in the front. So remote work policies would apply to potentially anybody in that workplace, but it's intended to focus more on offices. We understand that production workers typically have physical work that they need to do in that workplace. So it's not really that much of an issue. What we're really focused on here are those folks that work in the more office environment, but we still understand that there is physical work that needs to be done in there to make sure that your operations continue. That includes, picking up mail, sometimes physical forms, connections to databases, other things that need to happen, and we understand that. So what we did in our rule is we required that you create a policy prohibiting in-person work to the extent that their work activities can feasibly be completed remotely. Had a lot of good discussions over the last couple months with Mike and Dave about what the word feasibly means. And we're continuing to have those discussions, but within the MIOSHA parlance, that takes into considerations things like efficiency, technical feasibility, economics, and a few others. But we really need you to really push hard on this concept. MIOSHA is looking for a written policy, which can be part of that preparedness and response plan, does not need to be separate. Just a note, though, that MIOSHA doesn't have to prove that it's feasible. It's the employer that has to demonstrate that it's infeasible if a citation were to be issued. So just be aware of that you have a strong responsibility here. And our goal at MIOSHA is to educate before they regulate. So our goal is not to run out there and issue citations, but just understand that you're going to need to show that. And one of the ways that we're suggesting that you do that is in the determination on who can or cannot work remotely, you identify which positions or classifications must report for in-person work and why. And then to go along with that, put some reasons there that they can't work remotely, so that if you get a complaint, MIOSHA is investigating, they will have information that you've done an analysis that says, I've looked at the work that these people do and they can't work remotely because of X, Y, or Z. All these resources are available to you, and I put in bold here, which probably doesn't show up for you guys that much. We have an FAQ for the emergency rules that we're continuing to update. We just added 10 more FAQs today. It's at michigan.gov, COVID workplace safety. Right at the top, there's the emergency rules, a fact sheet, and then it says FAQ on emergency rules. It really touches on a lot of these highlights that I've listed here. One of the notes I had on my slides regarding quarantine and isolation, which I glossed over because I forgot, was some manufacturers are in critical infrastructure industries. And that does not change the impact of the rules. That does impact, though, potentially that quarantine piece. And we do have a very long FAQ on that right on that same website for you to check out on what that means. In certain situations, critical infrastructure industries do have some alternatives for an exposed worker who is not showing symptoms. But if they have symptoms or they are confirmed, the isolation is still required. So just be aware of that. And they have to actually be essential or critical to your ongoing operations. So a couple of considerations you'll want to think about there. We have a wonderful tool. Hopefully you've been using it. It's MIOSHA hotline at 855-SAFE-C19. Wait time went up last week because the use is going up, but wait time last week was 27 seconds to get to one of the MIOSHA experts. And they can answer a lot of these questions, so make sure you take advantage of that for sure. And if you need it, they will get you over to the consultation side. We have a couple of consultation programs. You've probably seen some of the ambassador program stuff in the news. This is a proactive consultation program designed for those generally open to the public type workplaces. So it'd be bars, restaurants, small retail, gyms, those types of places, like I mentioned, aren't used to seeing MIOSHA. So this consultation program is going to kind of get out there and just pop in and offer them guidance on how to implement these COVID-19 protocols. For manufacturing and construction, though, we continue to have our consultation and education staff available. Our partnership with NSF on the ambassador program is actually freeing up some of our consultants to come back for the purpose of being available for manufacturing and construction. So you can request that right at the MIOSHA website. They can do that on the phone. They can do it on site. We have some plans come in for review. We have questions come in that way as well. So feel free to take advantage of those tools. There's no cost to it. And our goal, as I mentioned, is to just make sure that you understand what these things are. I think we work together in Michigan under our MIOSHA statute with standards, education coming from MIOSHA, employers understanding and implementing those protocols, and then holding their employees accountable to those protocols. And I do want to make that point. If you know my background at all, you know I'm a pro-worker kind of guy, but employees have an obligation to follow the rules. And we have heard from employers that some employees are a little reluctant to wear masks at times, but you do need to be out there enforcing those things to really protect us all. We got a lot of great links up there. I won't get too deep into these, but If you need help with that daily health screening protocol, the My Symptoms app is free. It was created by DHHS and U of M. You set up an account as an employer, you'll get an employer-specific identification code that connects to your employees, and they can do that daily health screening questionnaire right on their smartphone, tablet, desktop, you name it. And they will get a flag if they flag for symptoms, and then the employer has a real-time dashboard that they can look at. It also keeps the records for you. So those records that I mentioned a while back that you need to keep, that'll be in the system, and you can download those as needed. The recently launched My COVID Alert app is a wonderful tool created again by DHHS that uses cell technology to identify phones essentially that get within 6 feet of each other. So if I were confirmed positive and I were signed up for this and Mike was signed up for it, he would get a notification if he came within 6 feet of me for 15 minutes or more. Doesn't use any other personal information beyond that. Some kind of weird cellular technology that I don't fully understand, but it works pretty well. They had a couple 100,000 downloads in the first few days. Great tool. Could be something you could encourage in your workplaces as well to help you with some of that contact tracing stuff that and notification you need to do. But certainly that would be probably more of a recommend to employees, maybe not a require. And I did go pretty quickly. I hope I was thorough. It's always hard when I don't get much upfront, like what I want you to say stuff. I'm just kidding. I'm just kidding. Mike and Dave were very clear on some of the issues that I should cover because they are coming up and they're sharing questions. And I appreciate that because we're out there in the field doing what we need to do, but it's critical that you're feeding questions back in as we try to figure out how to navigate this crisis.
Sean, thanks a lot for that presentation, and appreciate covering a lot of the questions that we were kind of talking about amongst ourselves. So I'm going to throw some questions at you that we've had come in through the our live event line and a couple others as well. Want to revisit something you said on close contact, though, there towards the end. We've had a couple people who have asked, what does close contact mean? What is exactly considered to be close contact?
Sure. So a close contact is anybody that you are within 6 feet of another person for 15 minutes or more. I think the challenge, this isn't actually new in Michigan, but the CDC updated their guidelines. That 15-minute is cumulative. So if you're engaging a few times, now I know there's some debate to be had about that. I think some people have shared with me, but that's the definition. Within 6 feet for 15 minutes or more, that's a cumulative total over a 24-hour period. We fully know that there are a lot of situations in the workplace where you will not know if that happened when you're passing each other in the hallway, shooting the breeze. Not that we ever do that at work, but shooting the breeze for a few minutes. So our recommendation is to look at it as more of close contact. So if we had an outbreak in a certain part of our facility, that we let everybody know in that area so that they can identify to us, not to MIOSHA. I mean, you as the employer, that, you know, I might have been within that range with him because we were doing X, Y, or Z. Okay,
cool. You mentioned during your presentation that the DHHS rules and the MIOSHA rules kind of overlap and what have you, and we're wondering, in a situation where a local health official or somebody from DHHS comes in, gives a certain direction, and then a MIOSHA guy comes in and gives a certain direction. If there's a conflict between what we are told by DHHS and MIOSHA, which rules, which order do we follow?
So what I normally encourage, and I didn't really get into on this one because most of your members have been doing this for a long time with preparedness and response plans, is to get familiar and consistent with the MIOSHA rules and understand them, apply them, and all that kind of stuff, and then layer in any DHHS orders that come out specific to your industries or things you might need to be doing, because both rules will apply, but if you look closely at them, especially for manufacturers, there really isn't much overlap. You know, the DHHS order specifically excludes workplaces as long as they're in compliance with the MIOSHA rules. So a health inspector is not likely to show up at a manufacturer, and you're going to really defer to the MIOSHA rules. Where we might see it a little more challenging is in those retail type spaces or bars and restaurants where DHHS has some strong masking requirements that might be stronger than MIOSHA's. And what I encourage in those industries, just for reference for here, is, the same thing. Take our rules and understand what you need to be doing for workplace safety, and then layer in any components you see that you think DHHS might have that are above and beyond that.
Okay. Kind of along those lines, and we still have a couple folks that are asking questions about the feasibility versus impossibility of remote work. DHHS is talking about, it doesn't matter about budgets, about software or anything like that. From MIOSHA's point of view, feasibility of remote work can include those considerations, or is it something that's off the table?
No, yes, it can include those considerations. What I would implore you to do, though, is look at the 14% positivity, the case counts, and just do what you have to do. Now, I understand the question is not because they don't necessarily want to get people out of there, but certainly within a MIOSHA framework, feasibility would include, that if you made $100 million and you don't want to spend 500, that's not going to work, right? But if you need to buy 200 laptops and those types of things, those are discussions that MIOSHA is going to listen to and have discussions about. So feasibility within the MIOSHA framework really falls into those pieces that we included for you to put in the policy, which is who's there and why can't they work remotely? And as long as that's thoughtful and reasoned, you're probably going to be okay. If it's just because I like my team here, that's not going to work.
Okay. Kind of following along those lines, we had a question about when you have a new employee, a trainee who's fresh on the job and they need training. How does the remote work policy interplay with their training? Can they be considered someone that has to be there in person for training and then go remote, or do they have to be remote the entire time?
So it sounds like that particular employee as a new trainee is going to be doing things that they can do remotely. I would encourage you to try to do that remotely. If we think about other new trainees coming in for production or something like that, that's a hands-on environment. That's going to look a little bit different. But I would say at least for the next several weeks, as we're looking at these case counts, do what you can do to keep people out of there, because we know that even in an office environment, many of you are going to have people that are going to have to be there. And anything we can do to really minimize that number to get it down to the skeleton crew that you can get by with, we need you to do it, because we're in trouble. We're in trouble in Michigan, and we got to work together to get these case counts back down.
Okay. Another question that came in involves Rule 7. That says a safety coordinator must remain on site at all times when employees are present on site. We have a small shop and offer flexible schedules, even more so now due to limit people in the office, such that it's not practical to have a dedicated person to do that job. Is it really necessary to not allow employees in the office if the safety coordinator is not present? Further, how many different people can we designate to be the safety coordinator?
So you can designate however many you need to make it happen. So if you have a flexible schedule like that, and it's going to be different people coming in, the safety coordinator is not, the COVID guru, as some people jokingly call me at times, but they don't need to be the COVID workplace safety director. They need to understand your COVID safety protocols and be able to see where that's not happening and remind employees to put their face coverings on and do those types of things, and just be able to report back to you either compliance or infractions and things like that. So if you're rotating people around, you can have several. Now, if you have a production site where everybody's coming in, you could have one by department. You could have one for the whole thing. I think just from a management perspective, if people are coming in, you probably don't want too many multiples, because somebody needs to, kind of coordinate that. But you can have more than one for sure.
Okay. Talking about preparedness and response plans, if those plans contain training information and we share that plan with employees, is that sufficient for training records?
So I think one of the things that the executive order required and the emergency rules do as well is that you've trained employees on how COVID spreads, and that can come in a few different ways. I think what you're going to want to think about is what is the best for your employees, right? Because if you have a lot of employees, we kind of get it that you get used to like sending out this thing and expect, you sign off that you received it, and we kind of all know that the employees probably didn't look at it, but we don't really follow up on it because it's just okay. There's just a lot to do. In the COVID world, I would suggest that you at least identify those critical pieces that are included in the rule, which are how COVID spreads and that types of thing. Do something like this. Just do something where you're going to do a 5-minute, like, here's this part, here's that part, just to get that word out there more. But certainly, and maybe that's what they mean by the training component, but the, keeping the record that you've done that will suffice.
Okay. Something about, got a question here on the health screening. Is taking an employee's temperature and having them do a self-check sufficient for the daily health screen, or do they have to fill out a questionnaire every day?
So the executive order and the rule both said that the daily health screening must include a questionnaire. So, that can be a physical questionnaire. Some workplaces are still doing that, but again, that's why I highlight the My Symptoms app. Takes all the work out of it, and they just, it's essentially about 6 questions or 7 questions, and that'll take care of it for you.
Okay. Question here on close contact. Does it matter if you're wearing a mask when you're trying to figure out close contact?
No. So as I mentioned, the face coverings are about 70% effective if we're both wearing them on cutting down transmission. Obviously, that's not 100. So CDC specifically says that they do not take that in consideration for purposes of defining a close contact.
Okay. Question here on the state emphasis program. How long will MIOSHA run the state emphasis program? Is there an end date to it?
Yeah, I believe we were planning through the end of the year. We intended to conduct as many of the randomly selected investigations we're going to do over the next 3 weeks.
Okay. When it comes to enforcement of the rules, MIOSHA will be enforcing MIOSHA rules. DHHS enforces their rules. Do we have to worry about local public safety folks enforcing any of the rules?
So I don't know the full answer for the local public health absolutely has the authority to enforce the DHHS orders. They're not part of MIOSHA though, so they can't enforce MIOSHA's rules. But where there might be overlap, we do get public health referrals on non-compliance with certain aspects, and we do get referrals from them on our rules as well. That I was here and they weren't doing X, Y, or Z. Okay.
We're down to our last 2 questions, and I know we got 2 minutes to go, and Mike looks like he's chomping at the bit. This question is about penalties. Will there be penalties if employees are working in an office space if cost prohibition is the reason why? More specifically, if we want employees in the office for sake of collaboration, is that okay?
No, I would say no. On that, if it's for collaboration, I just want my team here or that kind of thing, that is certainly feasible to be conducted remotely, right? Because we're doing it right now. And that's definitely something you want to take into consideration. I get it. We get it. Everybody gets it. Like, as humans, we interact better when we're together because of body language, gestures, and all the things that we do when we talk. So we understand that, but definitely you're going to, collaboration alone is probably not going to be sufficient. And then MIOSHA will work with you. It depends on the workplace and what you need and what kind of limits you have.
Okay, great. The last question is all about your PowerPoint. Will the presentation be provided at the end of this call?
Yeah, I don't know how quickly what I will do is as soon as we're off, we always put it in PDF because I can't have Dave and Mike changing anything on there. I would transfer it over to a PDF and email it to you immediately.
Cool. Thanks, Sean. Appreciate all the time, and I'm going to hand it back to Mike so he can say something about Go Blue, right?
Yeah, no. Thanks for that. Sean, you've been incredibly transparent, incredibly interactive with us. Thank you very much for all you're doing internally. I know it's a challenge to be the heavy, but I think you're doing a great job of being the heavy because you're keeping us informed of what you're going to do and when you're going to do it. So thank you very much for all you're doing. One of the things that takeaways I took a lot away from today, but just for brevity, that you won't be giving any heads up to the visits. I was under the impression that you were going to give heads up, but I guess you're not. So heads up to our members on that.
Yeah, MIOSHA actually can't. It's prohibited for them to give a heads up.
Ah, thank you for that. So with that, Sean, I'll let you get on to your other constituencies. You've been very responsive to us, so thank you for that and keep up the good work.
Thank you, Mike. I really appreciate you having me again. Anytime.
All right, tomorrow. All right, with that, thank you all who are attending. We have over 140 people on the call, very well attended. Sean, that means you're a very scary guy or a very informed guy. I'm not sure which. Think a little of both. But anyway, the MMA members, thank you for attending. Please feel free to send questions to myself or Mr. Worthams, and we'll get responses back to you. With that, we'll thank you again, Sean, and sign off.